So why do we want to consider this? First of all, trauma is very pervasive, not only amongst our patients, but amongst our staff. I'm not sure your experience in Florida, but I can't speak to the experience of the healthcare providers at my hospital, and particularly the frontline nurses, have been greatly impacted by the COVID pandemic and the caring for patients impacted by COVID. So trauma's there, and it always has been there, particularly if you're working in, high impact areas such as the emergency room and, and other areas of the hospital where we see acutely ill patients. The other thing is trauma really has a significant impact on health, and not just one's physical health, but their mental health. And it absolutely greatly influences how people access care, and if they do, and what that experience is like for them. So patients may not be able to engage because they may find just the accessing of healthcare is too traumatic for them. Healthcare can be re-traumatizing. Some of the things I've learned is, and I work with a lot of people that have been harmed by intentional violence, is, doing a thyroid examination on a woman who has previously suffered a non-fatal strangulation is going to be a very triggering experience. Performing a pelvic exam on a woman that's been sexually assaulted, or a man, and doing a genital exam is going to be different than doing that exam on somebody who has not had that lived experience. And there's procedures, there's distrust in the healthcare system by our communities of color for, things that have been done to their communities over the year. So that all makes sense to me. And I believe it probably makes sense to you. We put patients in the hallway on stretchers, and then we ask them all these personal questions. And sometimes there's only a piece of cloth between one patient and another. So you can imagine, and you can maybe have this appreciation for how what we tried to do as a healing profession can also cause trauma. I am not sure how many of you are familiar. What I find in my trainings is that most people are familiar with the terminology of trauma-informed care. But then when I often ask, do you know the 6 principles? They're like, oh my goodness, I didn't know there was 6 principles. So I do want to share with all of you that this is evidence-based. In 1994, SAMHSA convened the Dare to Vision Conference. And this event was intentionally designed to bring trauma to the foreground. And it was the first national conference in which women trauma survivors talked about their experiences and the way in which standard practices in hospitals re-traumatized and often triggered memories of previous abuse. So these principles evolved from that. And I find that, particularly working with patients that have suffered trauma, that these principles have really, shaped my practice. I also want you to look at these principles, and I want you to just for a minute pretend that this is through the lens of a patient. The patient might be thinking, what are they going to ask me? Do I have to tell them everything? Will I react to the questions, and will they think I'm crazy if I get triggered and I have these body memories? Are they going to do something that hurts? I really don't have good pain tolerance. I wonder if they'll give me choices, or if they will hear me. And if I ask them to repeat things, are they going to get annoyed with me? Will they help me to connect with others that I may need to see, or will I just have to do that on my own? Will they understand that I bring with me my culture, my historical background, my race, my ethnicity? Oh boy, I hope they don't ask me, why do you stay in this horrible relationship you're in? Why do you use drugs? So I don't know. I'm just hoping I'll feel safe and that I can share and that I can get the help and support that I need and use my voice. And I hope they can, acknowledge me for who I am, regardless of all the challenges that I have. So I hope as you looked at that slide, you could see me touching on safety and trustworthiness and peer support and collaboration, cultural historical acknowledgement, because I use these principles and I apply it in every case that I work with. And I use this as a framework to do my assessments.